Hello, this is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have Shashank Saini with us, who is the co-founder of Medpho. Is a healthcare startup who's trying to solve the three important challenges: that's affordability, accessibility, and also availability of healthcare in the rural areas, especially in the tier 3, tier 4 cities, and the Real Bharat. So, talking to Shashank on this, and also how they are offering free video consultations by MBBS doctors, that also free of cost to the patients who are in need. So, hi Shashank, welcome to Medicircle Healthcare Startup Series.
Thank you, Smita. Privileged to be here. To begin with, and thanks for the brief intro that how we are solving the problems and the healthcare services in the real Bharat. I think it's always been the underserved community in terms of an offline healthcare ecosystem too, where we don't see too much of big brands of hospitals in these deeper geographies, or even if they are, they're at a very city level, not at a deeper villages level. The government infrastructure is not as far as per the requirement in these geographies. We started Medpho with a mission to solve the three problems, which was the awareness, accessibility, and affordability. Right? We could study during the pandemic when we started, how the rural population was struggling to get a consultation with basic doctors. How do they navigate? How they have to travel 100 kilometers to come down to a city for severe illness. And broadly, there are two outcomes. Whenever they come into an encounter of an illness, it leads to poor health outcome or a higher financial outcome, right? Which comes from the two typical setups that we have in the rural areas is private hospitals, right, or the government setups. If someone goes to a government setup, he will not get the best of the health outcome. He will save on the cash, by default. Versus when he goes to a private hospital, he or she might spend good amount of money, which is a financial burden to him or her. Versus getting a better health outcome. And this was, in both the cases, the poor community people members are being impacted. With that mission, we are building Medpho. How do we create awareness? What are the mediums and modes that we are using? Online, offline, both sides. We understand the power of social media nowadays. We understand the power of content, videos. As Medicircle is also trying to drive that sort of an awareness problem, among the communities. Accessibility, is the problem where people are not aware where to go, when to go, whom to get. So this and affordability, obviously, we have been hearing too much about it, and the government also comes into a play where they are promoting good amount of central schemes or state schemes, which are at a low cost, where people, for example, Aishman Yojana have been a super hit, where people are, able to get surgeries under 5 lakh rupees of cost, absolutely free of cost. A lot of hospitals are being empaneled under Aishman. But to cater to a larger population, right, where we say that, there are some 500 million population residing in these geographies, how do we solve that? And the only answer which came to us was technology, right? We understand the nuances and the benefits of technology, right? If used rightly, it can be a boom, in the way we receive healthcare services. And with that thought, we started with a basic helpline, which is 88569, 88569, where anyone across the country calls and gets a absolutely free consultation with an MBBS doctor, right? We got a lot of pushbacks, that you will be burning good amount of money on this. It's not a scalable model. You should charge something. And even, we have a basic, in our country, it's a basic, anything which comes for free is not being categorized as good, right? There's always a cheat code behind it that, they are foolish.
Yes.
Yeah, and people don't trust, right? And there were other factors also that, you guys are fraud, while speaking to a doctor, you might hack our bank accounts and all the stuff. And we are talking to the tier 2, tier 3 communities who are more afraid, that they have lack of information on these sides. I think on every month so far, we started, I think, Medpho in the month of July, right? It's been 9, 10 months. We were more manual at that point of time when we were receiving calls. The early age members were taking some roughly 100, 200 calls per day, understanding what people want to say, how they feel when they are being told that you can speak to a doctor absolutely free of cost. Right? See, from a perspective of a local community member who spends 300 rupees for an OPD consultation, and when they see that cost, right, they are forced to avoid that illness, right? They will prefer not going to a doctor, right? They might take a medicine by themselves, or they go to a chemist, right? Or depend the local quack, those whom we call a jhola chhap doctors, and exactly, and that results into a longer or a bigger illness, right? For which they have to get admitted. So the entire movement was basically to move from cure to care, right? And that's what pandemic and COVID taught us, right? It's nothing. When the first wave was, it was like just care of yourself. Even today we say just wear mask, sanitize yourself, wash your hands properly, maintain. This is all care procedures. It's not cure procedures. Vaccine is a cure procedure. So even that was a shift. And today we do some roughly 10,000 consultations in a month, absolutely free of cost. We have impacted more than 1 million lives, right? This is how we're solving the accessibility problem. So 26 doctors live on our portfolio, on our panel, specifically from tier 2, tier 3 doctors who understand the local regional Hindi. Because in our northern, you go to UP, it's a different Hindi. You go to Uttarakhand, it's very different Hindi. Yes. So we have a mix of male, female doctors from tier 2, tier 3 who are doing these consultations on the clock, and it's absolutely free of cost. We just say that speak to a primary consultant. He or she is the best person who has spent some 5 years in medicine, will guide you to go to a super specialty doctor or not, will guide you which cure you have to take care of, you have to go for, versus directly going to a chemist and consuming medicines, right? That's what we do. It's just one of the the early entry points where consumers reach out to us. We also handhold entire the patients in the respective healthcare journey. If he or she has to go to a surgery, has to go for a medicine delivery, diagnostic services, home sample collection, ambulance. So it's more of a concierge of healthcare services that we have built up. We have a building up a hyper local network of pharmacies, diagnostics, hospitals, right? Anyone who calls our helpline is 100% solution he or she gets, right? It's not that you are from an Ayushman Yojana panel, or you are from an ECGS or CGHS panel, you will not be served. We serve all kind of patients that we can, right, up to what extent and the capabilities that we have built. 50% of the Ayushman patients we serve in terms of surgeries, we educate them. They are eligible for Ayushman Gold Card, then they can get these surgeries free of cost. So it's also reducing the financial burden for the tier 2, tier 3 committee members, because any severe illness they have to mortgage their assets, they have to seek loan, and that's a very long process, and they end up spending their life in paying back those things. So it's better you educate them, tell them that these are the hospitals which can give you a very low cost surgery in case a surgery has been recommended. So it's a complete healthcare service provider that we are into. It's pretty simple. You dial a number. We have our patient counselors or coordinators who will assist you, who will guide you in each and every step. We surprisingly get calls from a deeper geographies, from the uphills of North, Chhattisgarh, Jharkhand, Bihar. People are dialing and just want to speak to a doctor. It can be a second opinion. It can be a basic headache or a knee pain where they believe. So it's basically a behavioral change that we are bringing up in the market or in the committees. Is that don't avoid any pain, don't avoid any illness, any doubt, any confusion. Speak to your doctor. You want to speak 100 times in a day, we are there available 24/7. Just don't consume any medicines. Don't call to your friends and family for any medicine. Just speak to the right person and get consultation done.
Definitely, I think post-COVID, we all are seeing a big shift from sickness to wellness, and people are opening up to the facts that they need to be healthy, they need to be less likely to be falling sick. That's something, and in this case, startups like Medpho are definitely bridging the gap by making the information available and accessible to all those people who are deprived of this healthcare literacy information, because there are so many people still. I think I just shared that there are around 55 million people in India that were pushed under the poverty lane in 2017 because they were making out of pocket expenses, especially in the healthcare segment. So when the disease or the diagnosis is done in an early stage, it also increases a lot of chances of early treatment and early recovery, and that is actually going to help especially such patients with some chronic diseases also, and some other diseases also. That is, I think, Medco is making bridging this particular gap. So Shashank, there are a lot of other but healthcare management platforms also, like, so what is the important USPs of your venture?
Cool. So look, I'll be very precise on this. One thing is that we proudly say that it's an unlimited free teleconsultation. Rather you buy any paid service, you become a paid user to us. It doesn't matter to us, right? You just come, speak to doctor, go back. Absolutely fine. We'll never say no to you, or there'll be no other hook that which will be there from the team that you should be using. It should be the that you should ask pharmacy deliveries or diagnostics. No, you just want to speak to a doctor, go back, is absolutely fine. So I think we are one of the only platforms providing unlimited free teleconsultation. Now the other side also is when we pledge to serve the rural community, right? 86% public or the population has to travel to tier 1 for a super specialty illness care, right? Now moving from a city like Haldwani to Delhi NCR, might know a hospital, right? I'll go to AIMS, or I'll go to Max, or to Medanta, right? But this entire journey, if can be streamlined and make it more comfortable, starting point from Haldwani to Delhi NCR is what we also do, right? You will come to us, we'll tell you, okay, you have to go for a chemotherapy or any specific ortho knee replacement, right? These are the hospitals, right? These are the private entities. These are the hospitals which will accept your insurance if you have. The cost of the surgery that will be there. If you need some accommodation support in tier 1, we'll arrange for each and everything. You need an ambulance pickup, who the doctor is, your all files will be shared with the doctor in advance you go, right? And the onus lies with the patient to decide which hospital he or she has to go. It's nothing being forced by the Medco people team that you should go to Max, or you should go to AIMS, or you should go to Safdarjung. It's completely aligned with just a transparent advisory platform to guide the patient, that this is the right set of hospital where you should go, because we understand that ethos, the tier 2, tier 3 community flavor, it's very different. That we are serving to the underserved community, and here money is something really important. In case they want some financial aid, we have partners with us who can provide them financial aid too, right? That makes a pretty difference, and itself serving the Real Bharat makes us very unique, because I think there are very few companies who have been trying to focus on tier 2, tier 3 pain problems so far. And specifically, assuring that one problem, that connectivity with a doctor 24/7 at a zero cost, is itself an impactful, creation done by Medco and the team members here.
Definitely. So Shashank, as you have also offered your services to British High Commission in the Shoppers Stop damage Japan. So tell us how many lives you have touched.
So look, the corporate vertical, as we see a lot of companies, those who are into this business house, which is to be named, many the healthcare startups that we see, from PazCare, Plum, Praxo, MediBuddy, the N numbers to be named. We also work for the corporates, right? When we started because of the COVID push, we got few clients, and the marquee clients like Gale, BST, Fidelity, Goya, and all. Where we were able to support them in the teleconsultation piece, right? And why? It is because it is a zero waiting time. And we all realized in the pandemic that to get in touch with a doctor was 45 minutes on an average, right? Versus on Medpho platform is a zero waiting time. And that's how we have designed our tech and our efficiencies, to serve the employees, right? Uh, it doesn't end there. It is when when we see a B2B or a corporate, you also run the company, and the employees. Historically, it's always been insurance riding on the top as an employee wellness program. But now the things have been changed. Insurance is one of the layers, right? It has to become the health and the wellness itself is a broader game. Uh, and we as an aggregator or a partner in the healthcare services, we were able to offer many supports to our corporates, right? Which were while being in the COVID wave too, it can be a medical equipment supply, it can be a dedicated ambulance supply, it can be helping out their employees in hospitalization when they need it because of the large marketplace that we have created in terms of the hospital partners across the tier one and tier two, tier three. I think we were pretty fortunate in the span of 6 months when we started corporate. We got big brands with us, trusting us as a very young company in this field. Roughly some 25 corporates we onboarded. We were able to impact some 50,000 lives, which doesn't include their dependents also, and pretty economical. We firmly believe that primary care has to be economical. It cannot be expensive. If you really want people to stay healthy and you want to solve that problem, there are n numbers of ways to when you are a for-profit organization, you want to make money, you want to scale, but a basic primary care has to be pretty economical. It cannot be expensive at all. It has to be simple. Should not be a fancy technology. We don't have an app, right? While we work for big marquee clients, and everyone is so comfortable to use our web domains. Okay, yes, we do, because downloading a new app, asking their employees to download a new app is pretty cumbersome, and hence should focus on solving a problem. I think if you see from a lens of an HR, right, it's pretty difficult to manage multiple partners. You have a separate company for insurance, you have a separate company for teleconsultations or telemedicine as a service, you have a separate company for partnering with the hospitals and some other value-add services. Here, Medpho comes as a one single player who gives you insurance, who gives you health and wellness support systems. He also gives you all the ancillary services that your employees must need it. And also, right, I think the breaking point for us to enter in the corporate business was because of the tier 2, tier 3 network that we have created. Now, me coming from Uttaranchal, right? My parents live in Uttaranchal. I work in Delhi NCR. Now, if my health and wellness service provider of my company can give an access to all these tier 2, tier 3 hospitals to my family members, I will love it, right? If during the same COVID situation, all the employees were working from their homes. Now, if they don't have any service provider in tier 2, tier 3, or in their native areas, the offer from the corporate or from the employers goes for a toss, because a lot of companies, they offer services within their city or within their work location. We have expanded ourselves to tier 2, tier 3 because that's our core business line, and we are able to provide a complete service care from tier 1 to tier 2, tier 3 for the corporate employees also. And that was something different for us, where we had a lot of corporates loved us. Yes, lockdown hai, employees so wahan pe rehte hain, if you are coming, and specifically when we see Delhi and a lot of people come from Haryana, Punjab, Uttaranchal, UP, and these are our core strength areas. These are our launch states or launch cities, and we have an amazing supply and partners in terms of hospitals in these cities, and we are able to convince our early corporates, we can take care of you, though we are pretty young in terms of our starting this company, but we understand healthcare. We understand how healthcare has to be delivered, right? It has to be simple, economical, and that's what we believe in.
I think you have also, because starting the journey, when it gets a validation from the investors, it is also all good. So as you have also raised around $1 million in funds in 2021, so how has the funds been utilized so far?
Look, we have not we never had a lunch parties to burn that money out. We were just use it into two things. I think one is very important is to build the right product, which includes technology, right? And to get the right people. So we have been using our funds in these two specific areas, right? Because it's very important to get the right people who understand what you are trying to change, in this healthcare ecosystem, right? And when you have the right people who believe in you and the mission that you are into, will always build the right product for you and for the consumers specifically. So all the major investment is still going on. Building the core team, the right team members, and the right product for the users.
So what were your revenues in FY 2022, Shashank, and what you're planning to close at the end of FY 2023?
Cool. So in the last 9 months specifically, and then I'll say the specific, our revenue starts flowing in the month of August, right? Until March, we've been able to do some, roughly 1.2 CR of net revenue in span of 8 or 9 months oddly. Right. From here, we are trying to scale up our operations, and we believe delivering some 3x, in terms of while we exit 23, we'll be launching, a couple of cloud clinics, e-clinics now in the remotest parts of the tier 2, tier 3 communities, which when we say is the borders, meanwhile, where we have identified many locations where the healthcare is badly broken, right? So we'll be pretty much heavily going offline now, in terms of we have already scaled and put up good amount of technology on the online side. Now is the time when we go offline. We go with the community, and be with them, serve them at the ground level, and I think that will be the changing point for Medpho. I think 23 is pretty much important for us in terms of scaling our numbers, being with the committee, putting up our entire GTM on the offline side, and building up the clinics for the committee members.
That's great to know. So thank you so much, Shashank, for joining us today at the Healthcare Startup Series. Wish you and Medpho all the best so that it raises more and more funds and is able to especially help the rural population of India to the remotest pins so that they get more and more good access to healthcare, because everyone has got good right to have a good healthcare system, right from availability to also afford those services, which is pretty complicated today, especially in the rural areas. And giving video consultation, that is also for free, would be definitely adding it, because people would be realizing that definitely they can talk to someone and get their issues resolved rather than to postpone it just due to the finance issues. So thank you once again, Shashank, for joining us, and it was really a pleasure talking to you.
Thank you, Smita. Thank you so much. As we say, Medpho is hashtag bus a call. We're always a single call away for everyone. We'll look forward to serve the community at a larger scale and hope to make some difference in their lives. And thank you so much for having me. Look forward to meet you soon in person and having more fruitful interactions going forward.
Sure.